Hello, my name is Dr. Marcus Smith, and I'm owner and veterinarian at Chattahoochee Animal Clinic. Today we're going to do an exam on a healthy puppy and just kind of run through some of the common things that we look at when evaluating them during their shot series and as they become adults. So we'll start with the nose. Nose looks normal. Looking at gum color, making sure they're nice and pink. Looking at the teeth, everything looks good. As they grow older, they can develop some teeth problems, sometimes some dental tartar. But here, of course, we're a young puppy, so we look great. Next, we move into feeling for the lymph nodes. They live under the mandible or at the back of the throat area, and they also live down here towards the front part of the chest. So everything feels fine. So now we're going to move in. Look at the eyes. Eyes look normal. No signs of inflammation. The front chamber of the eye looks absolutely clear. So now we go into the joints, okay, and we're going to feel, this is called the carpus joint, that feels normal. The elbow, and flexion and extension looks absolutely normal. And then the shoulder. You press right here on the head of the shoulder, and you extend and flex. And that looks good. Move to the next one. Again, carpus feels fine. Elbow, range of motion is normal. Head, the shoulder looks good, and extension of the shoulder looks fine. So now we move down, feeling the ribs, chest, feeling anything that's abnormal, which nothing is in this young healthy puppy. So now we'll move in, we'll listen to the lungs, and we'll listen to the heart. And what I'm looking for here, or listening for, is for any abnormal rhythms of the heart, or beating of the heart, or any murmurs, which I do not hear. Listen to the lungs, making sure they're nice and clear, that there's no crackly sounds or harsh sounds, which there shouldn't be in this young healthy puppy. Everything sounds perfect, which is expected. Next we move down the spine. No pain, no abnormalities. Feel the belly, feeling for the kidneys, the spleen, feeling the gastrointestinal tract. No pain. Something to pay very close attention to as these guys get older. And nothing here, everything feels absolutely normal. Next we move into the back legs. We're feeling the pulse, which is on the inside of the back leg. And it again is absolutely normal, good pulse quality. Lymph nodes, they live behind the legs right here, and they feel absolutely normal. Look at the back end of the tail, everything looks good. Now we move into range of motion, okay, of the hips. So what we do is we extend them. And in this age of a pup, I would expect very normal, and they are. Okay, so now we'll go ahead and we'll look at the knee. And again, flexion, extension of this knee looks normal. Flexion, extension looks absolutely normal here. Moving into the tarsus or the ankle. And again, we just kind of move it up and down. And that feels absolutely normal. And then again, with this leg, same thing, up, down, and that feels absolutely normal. So next I look at the nails and make sure that they don't need a nail trim, because that can sometimes, they can get those nails hung up if they get too long. Everything looks great. So from mouth, nose, eyes, heart, lungs, joints, belly, everything looks absolutely normal. And this pup here gets a clean bill of health and is ready for the next set of vaccines or just to go home as a healthy puppy. And that concludes the exam. Thank you.